Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. For over 30 years, the CDC's Office on Smoking and Health has been the nexus of power for tobacco control in the United States. The office provides a comprehensive and coordinated suite of strategies that drives tobacco control initiatives across the country, encompassing policy, prevention, education, and support for quitting. At the helm for much of this time was Dr. Michael Eriksen, the longest-serving director of the CDC's Office on Smoking and Health from 1992 to 2000. These were crucial years when big tobacco was exposed for deceiving the public, and e-cigarettes were on the horizon, potentially disrupting tobacco control's ultimate goal of ending tobacco use for good. Joining us today to talk tobacco endgame and how safer nicotine products may play a role is Dr. Michael Eriksen. Dr. Eriksen, thanks for joining us today on RegWatch.
Thank you, Brent. My pleasure.
Before we get started, I do need to add a little bit more detail about your bio. In addition to his tenure at the U.S. Centers for Disease Control and Prevention, Dr. Eriksen is a Regents Professor and the founding dean of the School of Public Health at Georgia State, where he led the university's public health program from 2002 to 2019. He was the lead researcher on a $19 million grant to establish one of 14 tobacco centers of regulatory science funded by the NIH and FDA. He served as a senior advisor to the World Health Organization, and he's published more than 150 peer-reviewed articles and is co-author of all 5 editions of the Tobacco Atlas. Dr. Eriksen, how important is the effort today to get people to stop smoking?
Well, it's as important today as it's been for the last half century. The Surgeon General's, the first Surgeon General's report was 1964, 60 years ago. And that was the beginning of a concerted effort to get people to quit based on the knowledge of the harm caused by cigarette smoking.
Now, I wanted to ask you about lung cancer. Most people believe that that's the real killer when it comes to smoking. Is that correct?
Well, lung cancer is the leading cause of cancer deaths due to smoking. But most people die of cardiovascular disease, coronary heart disease, or stroke from smoking numerically. But lung cancer is the disease that is most linked to smoking. About 95% of all lung cancer is due to smoking, whereas with heart disease, it's only about 30% of heart disease is due to smoking. So lung cancer is a good marker to look at in terms of progress, in terms of reducing smoking and its impact on public health.
Take us back, if you will, to the 1990s and the tobacco wars, and describe the battle back then.
Yeah, it was, I started my work at CDC at the Office on Smoking and Health in 1992, and it was the last year of the Bush administration, and there was very little attention or investment in tobacco control from the federal government. And a lot of that was attributed to Jesse Helms, who was the senator from North Carolina, was extremely powerful and blocked policies and funding for tobacco control efforts. And in '92, at the end of '92, Clinton won the presidency, the House and Senate changed, and shortly thereafter, Jesse Helms passed away. And the environment changed dramatically from ignoring smoking as a cause of death to actually beginning to both fund it and to investigate it. And that was during the time there were the Waxman hearings and FDA's original effort to regulate tobacco products.
Yeah, that in the famous congressional hearing, right, where all of the presidents put their hands up and essentially lied about the addictive nature of nicotine?
Yeah, I was in the congressional hearing room for that hearing, and what was really interesting about it, the environment was electric.
Let me begin my questioning on the matter of whether or not nicotine is addictive. Let me ask you first, and I'd like to just go down the row, whether each of you believes that nicotine is not addictive. I heard virtually all of you touch on it, and just yes or no. Do you believe nicotine is not addictive?
I believe nicotine is not addictive, yes.
Mr. Johnston.
Congressman, cigarettes and nicotine clearly do not meet the classic definitions of addiction. There is no intoxication.
We'll take that as a no, and again, time is short. If you could just, I think each of you believe nicotine is not addictive. We just would like to have this for the record.
I don't believe that nicotine or our products are addictive.
I believe nicotine is not addictive.
I believe that nicotine is not addictive.
I believe that nicotine is not addictive.
And I too believe that nicotine is not addictive.
They all said, I believe that nicotine is not addictive. And the next one said, I too believe nicotine is not addictive. And they went down the row. And shortly thereafter, I was contacted by the FBI, and they wanted to investigate whether the tobacco executives committed perjury by lying in front of Congress under oath. And we went up to the FBI's office and briefed them on nicotine and what we knew about its addictiveness and things. And it turned out they never prosecuted them because they said, I believe, and you can't be prosecuted for a belief in terms of perjury as opposed to a fact. So very clearly, there was some collusion going on amongst the executives in terms of exactly what to say. Not that nicotine isn't addicting, but I believe nicotine isn't addicting.
I mean, isn't that the case that Big Tobacco, certainly at that time, had some very good lawyers that possibly did work together?
Yeah, I mean, I think I'm surprised it was never pursued in terms of collusion, but they did have a common defense across the different companies, even though they were competitors. And at the time, there was no congressional oversight prior to the Waxman hearings in 1994, where they all appeared and were grilled. And during that time period, it was top of the news type of coverage, and it was above the fold. And the world just changed. And then when Kessler, the commissioner of FDA, announced that he was going to regulate nicotine, it even became more and more of a front page news story.
Well, it certainly was, and it had a lot of impact around the world. In Canada, I'd already been in television news for 6 years, say in 1994. I'd already been working in news for 6 years, and I can tell you firsthand that it captured the entire news cycle over and over and over again for many years because, of course, smoking, was so terrible. And what you were doing down in the U.S. was so innovative. It wasn't happening elsewhere.
Yeah, it was interesting. I've written a lot about the diffusion of tobacco control policies, and I started my public health career in San Francisco in the early 80s when they began to implement workplace smoking restrictions. And the bills were not initiated by the government, either the state or local. They tend to be initiated by advocates who were concerned about being exposed to secondhand smoke. And often many of them had to become ballot initiatives to get passed and get implemented. And then that began to change the norms and perspective about smoking and secondhand smoke, and became an issue that spread throughout the country, spread throughout the world. And the same with the FDA's regulatory efforts to for the first time to regulate tobacco. The reason I laughed is when I was at the Office on Smoking and Health, there was something called, the federal government has something called controlled correspondence. So in other words, when someone writes a letter to a high-ranking government official, it goes to an office and they provide standard responses. And then the standard response from the FDA used to be that when people asked, why doesn't the FDA regulate tobacco, they said tobacco is neither a drug nor a food, it's a device of pleasure. that was the standard response. And so when Kessler initiated an effort to regulate tobacco and nicotine, it was really groundbreaking change for the FDA.
Wow, that's amazing to hear that was that standard response. I can tell you I smoked for 25 years, and it was a device of pleasure for me too, though with a heck of a lot of consequences.
Yeah. Now I smoked as well, and we can talk more about it later. But and you can imagine, I mean, that someone wrote that control correspondence response who was a smoker and was just being reflecting his or her own perspective on smoking, and it wasn't in the statute. And ultimately that resulted in the fact of the Tobacco Control Act being developed, because it was determined by the Supreme Court that FDA didn't have the authority to regulate tobacco because it wasn't explicitly in the Food, Drug, and Cosmetic Act.
You mentioned that whoever wrote that response, that controlled response, was likely to be a smoker, and that's because so many people in the United States were likely to be smokers at the time, were smokers. I have an article from the Washington Post published in 1994. The title is Study Says Adult Smoking Dropped to 25% in 1993. And that's 46 million adult smokers at the time. So in the article, you said, you're quoted as saying that there's a discrepancy between people's desire to quit and their ability to do it. So let me ask you, Dr. Eriksen, back in 1994, quitting was hard, was it not?
Yes, it was. It was hard then, and it's hard now. It's a very addicting drug, nicotine, and it's also a pleasurable habit. So you have those two things. I remember some of the industry documents would say that nicotine is beneficent in that it both calms and makes you alert at the same time. It has this paradoxical effect of both calming you, but also making you attentive. And so it has some unique neurologic effects that are hard to match, and then hard to give up. So but that existed in the 90s and exists today. Although now there are more ex-smokers than there are current smokers, and that's just shows that it can be done. Both of us have quit, and it's more than possible. It's kind of the norm, actually.
So what role then do you think ENDS products like nicotine vapes have played in bringing down that smoking rate, in helping people to quit?
I think that it's unclear somewhat in terms of the exact role that they've played. I think there's been since for the last half century, there's been somewhat of a very gradual, inexorable decline in smoking rates that has accelerated over the last 10 years or so. But I don't know if anyone's really been able to partition out how much of it it's due to alternative products or ENDS, or how much of it is due to social norms that it's become so ostracized that more and more people are rapidly giving it up. But I think it's important for people who can't quit on their own and have tried FDA approved medications and it doesn't work, and they've tried everything, it doesn't work, to have a safer alternative that they can try to see that will help them end the smoking of combusted tobacco, which is really the major public health problem that we have.
So do I take it then from that answer that you've got some support for nicotine vaping products if they're the device of last resort, I guess?
Yeah, I think that whatever you can do to get someone to quit smoking should be pursued, and I think that the evidence is accumulating that for some smokers and alternative nicotine products, whether it's vaped or orally used, is effective, and as effective as FDA approved products. The problem, I think, from a medical standpoint, a public health standpoint, is that the FDA approved products are the first line, so to speak, of recommendations, because they have the seal of approval from the FDA, whereas vaping products do not, and that makes it harder, I think, for clinicians and health professionals to recommend them as they do for nicotine replacement therapy or Chantix or other types of FDA approved medications.
What do you make of the research? I mean, in my mind, there was the Hijack paper that came out in the New England Journal of Medicine in 2019. Of course, there's been series of Cochrane reports. The Royal College of Physicians in the UK, in fact, came out with a report just yesterday, double downing on their 2016 report, Nicotine Without Smoke. There's U.S. research that's happened that we've brought the researchers on that said that's e-cigarettes are an effective tool to quit smoking, more effective than nicotine replacement therapy. Does any of that, impact your thinking?
I think there's a couple of dimensions to it, and one is that, and medical innovations take a long time to creep into practice, and actually evidence-based evidence or findings, there's data to show that it takes years often for it to be actual routine practice. I think in terms of cessation, there's still some questions as to how the product should be used to be most effective, and the trials that have been published may not be real life examples how the products are used on a day-to-day basis. And one of the things that our research has shown is that the frequency of use of ends or electronic cigarettes is an important factor in the likelihood that someone will be able to use the product and actually stop smoking. And that's not being communicated in any organized way to people who are wanting to quit and trying vaping products, but aren't necessarily using it in a way that's likely to lead to cessation. And again, some of our findings are that people tend to do both, are dual users for a period of time.
Now, is that dual use? I think back in 2015, 16, when we first started covering this issue, dual use was brought up a lot by folks that were concerned about e-cigarettes being on the marketplace. And still to this day, there will still be some researchers that will be talking about dual use. I'm wondering, is it as much of an issue now as it seemed to be used to be, or is there a little bit better understanding of the cycle that it takes for a smoker to fully onboard e-cigarettes and then fully off ramp the combustible?
Yeah, I think it's still a major issue. I don't think it's resolved, or that there's evidence to show that there's a month or 2 months or a week optimal dual use, if any, and it's still pretty unknown. And this one of the projects we did, we looked at smokers who were both smokers and vapors after a year. And after that period of time, 90% were still smoking. Some of them were dual using, but only 10% either stopped smoking completely or stopped vaping completely. So I think the evidence is that dual use is still of concern, and there should be more research in terms of what's an optimal period, if any, for dual use. And how much is it being used to supplement smoking and continuing smoking rather than quitting, because you can use a vaping product when you're not allowed to smoke at work or in a restaurant or something like that. So I don't think it's resolved as an issue. I think it's still of concern, and there's a need for better understanding of the optimal period of dual use, if there is one.
So let's turn to teen use. Obviously, that is the issue that seems to be driving a lot of discussion in the media, a lot of regulatory action, a lot of advocacy from groups like Campaign for Tobacco-Free Kids and Bloomberg Philanthropies and everyone, really. It's always about this teen issue. I'd just like to point out, though, that when the teen vaping epidemic, so-called, was first kind of announced in 2018 by then Commissioner FDA Scott Gottlieb, when he said that it posed a clear and present danger to youth. Since 2019, it's almost dropped teen use by around 60%, at least according to the 2023 NYTS data that just came out at the end of last year. And I mean, we could probably quibble about, how big that percentage number is, but it's certainly a lot that it's dropped. So is it the same issue today as it was in 2019, and should we be reacting to it the way that we are?
I think it's hasn't changed really in terms of public opinion or attitudes or sentiment towards youth vaping, and it's kind of independent of the numbers. I think that people react emotionally to kids' well-being and welfare, and whether it's 20% or 10%, it still generates a concern. And again, I think that needs to be better understood as well. I think part of it is the concern that some kids who may never smoke are vaping, and that's a problem. There's issues about the amount of nicotine that are being consumed. And when I talk to people, parents casually, they, recount situations where kids are, getting dizzy and physically not sick, vomiting sick, but that they're getting more nicotine than they would have gotten from smoking in some instances, because smoking has more of an adverse effect, whereas the vaping products don't. So I think there's some emotional and genuine concerns about kids smoking. I think the point, though, is that the potential that these products have to help adult smokers quit is underappreciated, and the standard of appropriate for the protection of public health has been basically weighed towards not having the evidence that it isn't a problem for kids, as opposed to the creating an environment where they could be used, like in the UK, to be of benefit to smokers to help them quit.
All right. So the FDA, the U.S. Food and Drug Administration, they have the authority now to regulate tobacco products. And you were talking about at a time there in the 90s where they didn't have it. Walk us through, how did they end up getting this authority to do that, to regulate tobacco? And then how did vaping come into the mix? And a lot of our viewers know this, but would love to hear your overview.
Yeah, it is very interesting. I teach a course on tobacco control, and I start out every semester reviewing the history of FDA's effort to regulate tobacco, and it started in 1994. And and this is something most people don't realize unless you're really have been involved and somewhat a nerd about it. But the week that David Kessler announced that he was going to attempt to regulate nicotine was the same week that the Surgeon General's report on kids came out, and FDA's action was on page 1, and the Surgeon General's report was on page 14. And it was like it broke our hearts, because usually the Surgeon General's reports get front page coverage, and this one was on kids. And it's the first one that was ever on kids, but it got buried because the FDA announcement was such big news. But it was overturned by the Supreme Court in 2000. They were sued by both the tobacco companies as well as the advertising industry, and went to the Supreme Court. And Sandra Day O'Connor, who was read the decision, basically said that tobacco should be regulated, particularly its impact on kids and the harm caused to society, but FDA doesn't have the authority to do it, and that Congress has to grant it. And that was in the year 2000. And it took till 2009, 9 years later, for the Congress to give the FDA the authority to regulate tobacco products by writing a new chapter in the Food, Drug, and Cosmetic Act, specifically for the regulation of tobacco products.
I'd love to be able to capture, if we could, what tobacco control's reaction was when e-cigarettes first hit the market, but not when they first showed up. But when the prominence of them started to take off, were they disruptive to smoking cessation efforts? Like, were they disruptive to tobacco control?
Yeah, my feeling is, in my own sentiment at the time was, I wasn't agnostic about it. I had some concerns, and I also saw some potential, because I think everyone agreed that combustion was the problem, and that if these products were like NRT, and that they delivered nicotine without delivering harm, they would be a great advance. And at the same time, some of my concerns were that it was going to be result in some former smokers like myself who quit smoking but enjoyed nicotine, would bring them back into the franchise, would bring them back into using nicotine because they could enjoy it safely without any harm. And I was concerned that was just one step back to smoking. Now, that hasn't panned out, but that was part of my sentiment.
I wonder if that concern is still what motivates a lot of opposition from some in tobacco control to e-cigarettes. Is that because I can tell you, like, recreational nicotine use is what a smoker is doing. So if you could enjoy recreational nicotine without any of the disease and death, then, more power to you. Should it not be that?
Right. I don't hear people saying it explicitly that's a concern. I mean, it was a concern of mine, and I felt like it really hasn't been borne out. And I also have the concern that vaping in public would normalize smoking again and would complicate smoke-free laws and things. And I don't think that really panned out either as a reason of concern. So some of my original concerns were not, validated. The kid issue wasn't a concern originally, but turned out to be the major concern. And a lot of it was obviously fueled by Juul and the flavors and the marketing that was being done. And I think that was more of a factor in developing the antagonism towards these products than anything else.
Let me ask you, is it fair to say that there is a struggle within tobacco control regarding the embrace of e-cigarettes, ENDS products, nicotine vapes, however you want to call it? Is it fair to say there's a struggle?
Yeah, I think there's a war beyond the struggle, in that there is very little common ground in terms of people who are anti-vaping versus people who are pro-vaping and public health. And that's one of the big challenges, is to have dialogue among it and kind of agree on what the evidence indicates. And I tweeted a few years ago, when I used to be on Twitter, it was like I said something like, it's amazing how much of a difference the Atlantic Ocean makes in terms of views on vaping. And who would think that an ocean could influence how people view data? But if you look at the US and the UK, it's just like night and day. And the only thing different between us is the Atlantic. So there needs to be more common ground. And the other part of it is, the residual or the current antagonism towards the tobacco industry, and that much of the opposition to vaping is due to who's selling the product, that they have a history of deceit in terms of smoking, and it's not. I also show my class the verdict from Judge Kessler and what she had to say about tobacco industry's behavior, which is now currently reflected in the corrective statements that are in the U.S. Regarding the findings of the trial, of which I testified. And so, I think there needs to be an analysis of the factors such as kids and how people feel about kids, about the industry, how people feel about the industry, about the evidence around cessation, and how these products are helpful or how they need to be used to increase the likelihood of helping someone quit smoking.
Yeah, you brought up how possibly could an ocean impact the way in which scientists and public health evaluate science, right?
Right.
And yeah, and from the layperson side, for the people who use these products who are frustrated, they see it all the time. They'll refer to it as junk science and this and that. I've even heard public health sometimes say that there is junk science out there. How much is the issue also from the research? Like, who's funding the research? And in this case, it's not big tobacco would be the issue. It would be like, NIH funding.
Mm-hmm. I think there's, as we were talking earlier, I think there's been an overemphasis on funding research that's focused on kids and products, and less on focusing on how these products can be useful to help smokers quit. And that deserves, I think, some scrutiny, because the public health standard for the FDA is appropriate for the protection of public health, and that's a balance between these products helping people quit or kids starting to use them, and the potential harm there. And there really does need to be more focus on the role of these products in helping people quit. And I think there's mounting evidence that they are as good or better than what we currently have if they're used in a proper way. And a proper way, ironically, is frequently and a lot, as opposed to sparingly, and certainly not just to use it when you can't smoke to supplement and maintain your smoking. And so that's the complicated nature of it. And some of the articles that are coming out are showing that dual users who continue to smoke as before and are using vaping products for supplementary nicotine are having higher levels of biomarkers of concern. So, and
that I can understand. What if you're upping the intake like that and right. The dual action? Let me ask you. So we were talking about FDA, and this deeming rule. So that they issued it was like 1,000 pages or something like that of the deeming regulation in 2016. It's a point of contention for me. It's a point of contention for a lot of people. So you take a vaping device, and this plastic tip is deemed a tobacco product, or the battery is deemed a tobacco product. It just seems to be like, I cannot understand that. It's like it's a bit of a misuse of language. So, and then now you've got products that don't have nicotine derived from the tobacco plant. Right. So it's synthetic. So there's like nothing to do with the tobacco product. Is it a misapplication? Should there not have been some other form, or because it's not written in another form, like electronic nicotine delivery system. I don't know if that would fit within the legislation or the deeming. Maybe they have to call it a tobacco product in order it to become regulated. I don't know.
Well, there was in addition to the deeming rule, there was also a determination that synthetic nicotine would fall under FDA authority, because, as you know, originally it was nicotine derived from tobacco was the language in the law, and that was changed to include nicotine of any origin, whether it's from tobacco or synthetic. And during the first effort, the FDA, before there was the chapter of the Tobacco Control Act, cigarettes were considered medical devices, and that was the approach the FDA was taking, since it wasn't a food, drug, or cosmetic. They also, besides those areas, they do have regulatory authority on medical devices. So it was looked at under their device authority. Today, I do think. I mean, we're really, I think, we're struggling with this because of both technology and the ability to separate nicotine from combustion in a way that people enjoy and find acceptable. But there's all these, FDA, it's unclear what's going to happen with, cannabis, for instance, or CBD in terms of regulations, because of the technology that's now available and the way the products are being consumed, and who, if anyone, should regulate them. And should it be done by FDA or DEA, or should it be done by states? We're really at the kind of the forefront where I don't think anyone feels there's an optimal scheme in place now to deal with this products. And nicotine is the most commonly used, or had been the most commonly used. I think today kids are more likely to smoke marijuana than they are to smoke tobacco. But overall, there's still tens of millions of smokers, combustible products.
So a big concept around vaping advocacy is called tobacco harm reduction. It's a smoke and tar that kills. So if you can deliver the nicotine in a less hazardous form, it's better for the public. But not everyone buys into this concept. One of those people is FDA Commissioner Robert Califf. Here is a quick clip of comments he made about nicotine vapes and tobacco harm reduction during his testimony before the U.S. House Oversight and Accountability Committee earlier this month. Let's take a listen.
Had the CTP done its job over the last decade, there should have been tobacco harm reduction products approved through the appropriate process.
If I may, tobacco harm reduction product is an industry term. Vaping, if combustible tobacco didn't exist, you'd be horrified by what's in the residue from vaping. When you think about that going into your lungs over the course of decades, it's pretty horrifying.
Congress enshrined harm reduction as a kind of a pillar in the 2009 Tobacco Control Act. Unfortunately, the Center for Tobacco Products' current leadership seems to have abandoned harm reduction as a foundational principle of its tobacco policy by refusing to authorize other tobacco products that have been pending before your agency for years. And if you have 900 cigarettes that have been approved and only a handful of vape or other products, that seems to be divergent. So in addition to vaping, you have other products like Zyn or something similar to that. Would you consider that to be a harm reduction product?
The term harm reduction tends to be used by industry to cover a lot of different areas.
Commissioner, in this hearing, you have said that the term harm reduction is an industry term, or a term that industry uses. But to be clear, it's not just industry that uses this term. The Institute of Medicine uses it. And the concept of harm reduction has been embraced in other countries. That is, they accept and communicate that there are options that are less risky than a traditional cigarette. Are we ever going to get to that point in this country? Do you accept this idea?
Definitely accept the idea. Your point is well taken that industry is not the only entity to use it. But what I want to avoid, speaking of harm reduction, we've talked about combustible tobacco kills people. Neither using vaping or combustible tobacco is the healthiest thing you can do. Vaping, compared to none of the above, has residues that are quite concerning for long-term use. I'm just worried that when we use the term harm reduction now, it's often part of a vast advertising campaign that's not taking account of the addiction side.
Dr. Eriksen, what are your thoughts after seeing this? Is tobacco harm reduction an industry term, or, as implied, an industry campaign to deceive the public?
Well, I watched the hearing live because I'm a bit of a junkie around congressional hearings and things like that. And I was surprised by the back and forth that was occurred, and didn't agree with Commissioner Call's characterization of harm reduction to being an industry term. I think part of it may be, influenced by some of the, not trickery per se isn't a fair word, but, the light cigarette fiasco that occurred in the past, where products were marketed in a way to imply that they were safer, healthier, when in fact they weren't. They may have been more dangerous. And I think that there's this paranoia that harm reduction is part of an effort for the industry to deceive or promote a product that there's uncertainty about. But harm reduction is a common term in public health. It's used in a variety of areas, particularly in drug use, but across the board to do something or use something that's less harmful. So I don't think that was a fair characterization of harm reduction being an industry term. I think part of it, there's still this legacy of distrust that exists for the tobacco industry, and I think rather than giving the benefit of the doubt, there's continued suspicion that they want it both ways. They want to continue to sell cigarettes and also sell these novel products, which until there's some clarity about what the end game is for tobacco companies and for combustible cigarettes, I think there's going to continue to be some distrust and suspicion that's a function of behavior over the last century, really.
The hate that public health has for big tobacco is really now damaging the millions of people who effectively quit smoking with vaping products and plan to continue for many years enjoying the pleasures of a safer nicotine product that won't kill them. And it's just like never ending.
Yeah, I think the problem is going to become greater in the future because as market share increasingly goes to tobacco companies, all of the tobacco companies have their harm reduction products are expanding their repertoire. They're buying up unaffiliated companies. And so that's going to continue to be an issue, even though there's an independent industry. It's increasingly being owned and corporatized by tobacco companies. The other issue that is in keeping with that is, and it has to do with the product and where the product is coming from, whether it's coming from big tobacco. But as a hearing that we just listened to, there was a major concern about disposable e-cigarettes coming from China. And that was a huge theme that everyone seemed to agree on. It seemed to be a bipartisan issue, and even the FDA agreed that it was of concern. And so the kind of the origin of the product, whether it's from a tobacco company or disposable coming from China, is a factor that needs to be better dealt with and understood in terms of actual harm. And I have less concern about a tobacco industry harm reduction product than I do of an import from China when there's a history of not having the good manufacturing practices that we have in this country.
Yeah, going back through some of the material on your career as as the director of the Office on Smoking and Health at the CDC, there was a couple of mentions about your position in terms of being at least open to the conversation of allowing tobacco companies, the industry, to work with the public, maybe not on partnerships, but definitely in some manner. Has that openness changed, or is it what should be the case still today?
For me, it's always been the case in that, as director of the Office on Smoking and Health, we had a obligation to meet with the tobacco industry in terms of their responsibilities of reporting, and so we've always had an open dialogue, kind of required by statute, and got to know individuals in the industry. And I also testified against the industry in a number of court cases. And in that context would meet their attorneys, who I didn't think much of, but the executives themselves. And I think that you never are harmed by learning more and understanding perspectives. The concern in the public health community is that by doing that, you give it legitimacy. And I think you need to be, there need to be real guideposts, so to speak, about dialogue, and that it's not interpreted as endorsement necessarily, and that there is concern about continued sale of combustible products. At the same time, you want a smoke-free future. And how do you reconcile that? There's still a struggle, as you said, between public health community and the industry, and I think there needs to be more commitment of change. I mean, I'm impressed by the fact that PMI, for instance, has spent billions of dollars on IQOS, but at the same time they're getting tens of billions of dollars from the sale of combustible cigarettes. And at some point, there needs to be a commitment to end the sale of combustible products. And, the industry's shown that they can collude in the 90s, and they can work together to survive a congressional hearing. Well, why don't they work together to end the manufacture and sale of combustible cigarettes?
A question we've asked a lot over the years, but never got a really good answer, because I don't know if there is one. Why is it that, say, for instance, the United States Congress and Senate could pass a law that just bans the sale of combustible tobacco products? Like, how come public health has not been railing for 20 years to have, government, ban combustible tobacco? What is it that allows them to continue to sell this deadly product?
Yeah, I think there are two aspects to that. One is that over the decades, the tobacco industry has been successful in putting exemptions in laws that like environmental laws or safety laws that exclude tobacco products from them. So they've included in statutes protections. The Consumer Product Safety Commission can't regulate tobacco products, and other environmental laws is one part of it. I think the other part, though, is we've learned that prohibition and banning doesn't work. I mean, the alcohol experience is, a real experience, and that, in public health, there are three aspects of dealing with a problem. One is control, that you try to limit the harm something causes. The other is called elimination, where you do the best to limit people's exposure, but it's never totally gone. And the third is eradication. And eradication applies to like smallpox, where smallpox, no one has had smallpox for decades in the world, and that has been eradicated, even though it exists as a virus in CDC in Atlanta and in Russia. But so for tobacco, I think everyone says it has to be tobacco control. You're not going to eliminate it. You're not going to eradicate it. It won't work in our country, in the U.S., for prohibition. And so you want to make it, as I think was made explicit by Commissioner Gottlieb and Mitch Zeller, is that you want to make the products less addicting, less appealing, and you want to provide alternative products for people to transition to. And we've not been able to do that yet. And I think that's the real challenge for the FDA today, and something that's achievable.
Well, is the question that I have with regard to the FDA, because their actions appear to be a de facto ban, because the PMTA process has been such that it is. The whole thing about what's appropriate for the protection of public health being so skewed totally to whether or not teens might engage use with the product. So that's it, right? So like no flavors, no products. It's like a de facto ban. What do you make of that?
Well, I look at the proposed ban on menthol and how that's being handled by the FDA. And it's on combustible products. It's not on all products. And I think that's really significant, even though it hasn't been approved or signed off on by the White House and may not be. And I know that certain jurisdictions like California has a flavor ban on all products. But I think strategically, the FDA put forward the menthol ban only on combustible products to allow the opportunity for there to be an off-ramp for menthol smokers who can't get menthol cigarettes if there's a ban, and can use other products, vaping products that are allowed to have menthol, at least federally, from a federal perspective. So I wouldn't consider it to be a de facto ban. I think they're struggling with how best to do it, particularly with the kid issue and the flavor issue. And we've written ideas about how to keep kids from vaping products in terms of technology, and they have Bluetooth capabilities, many of them, and having certain using technology to its fullest potential. So until the kid issue is resolved, and I think Juul exacerbated it, and they've learned from that now, and I think that they're realizing that that's the third rail of vaping is purposely or unintentionally, but having the effect of having kids try the product, and that's not going to get anyone anywhere. And I'm encouraged what I see with IQOS, which doesn't seem to be a kid product. So I think alternative products can be developed that are not appealing to kids, and I think that will. And IQOS did go through PMTA and MRTP processes.
So where do you see the tobacco endgame moving forward with all of this mess?
Yeah. I would, it's interesting. I think about this a lot. And I go back to Surgeon General Koop in the 90s, and he called for a smoke-free society. And, we've lost track of that. Where now we're talking about a tobacco-free society, and we're talking some about a nicotine-free society and stuff like that. And I think a smoke-free society with smoke connoting combustion is achievable. It doesn't mean that people won't be vaping or using oral tobacco products, or some people continuing to smoke, but at levels, single-digit levels, under 5%, not banned, but treated in a way. And this is what I would say when I was, at CDC, was you treat tobacco commensurate with the harm it causes. So those products that cause a lot of harm, they get restricted and regulated and taxed and can't be advertised. And then products that are less harmful have policies that not encourage their use, but help inform people that this is better than smoking.